profession of a doctor and a dentist is very challenging and very competitive. And I congratulate all of you on becoming a successful doctor or a dentist. When you have put up a lot of effort, you have gone through a lot of challenges, you have sacrificed a lot to become a doctor or a dentist. But once you become a doctor or a dentist, the most challenging part and the bigger challenge that comes into play is how to become a specialist. And with the situation where we find ourselves in India, where the things are so competitive with reservations and the system as such, it's not that easy for every doctor, every dentist to be a specialist. Hello folks, I am Nikhil here from MissionGermany, the Education Network. I guide doctors and dentists for their medical dental licensing in Germany, so they can work in Germany as a doctor, they can work as a dentist in Germany, followed by their specialization training. Fine. Before I really venture into the German system as such, I was eager to make you understand the difference between the Indian system of medical training and the German system of medical training. And what I find the biggest difference between the two is that in the Indian system, when you complete your medical education and when you want to be a specialist, the pattern is structured in such a way that it doesn't give us a settlement option for doctors, because once you want to be a specialist in India, you channelize your training through universities and colleges for which you are paying the fees, and the duration of your medical dental training is considered as a study period and you are treated as a student because you are paying the fees to a college or a university for which nothing is paid to you or peanuts are paid to you. Unlike the Indian system of medical specialization training or the dental training, the Germans are following a altogether different pattern, which is quite similar to the residency in the US, where once you get a license to practice medicine or dentistry in Germany, you start working in a hospital or a clinic, you are paid by the hospital or the clinic, and you are trained by the hospital or the clinic. So in this setup of things, it is something like job or training program, where you are working in the hospital, you are paid by the hospital, and you are trained by the hospital. So in this sequence of things, unlike the Indian system, where you are paying money to be a specialist, in the German system, you are paid money to be a specialist. So it gives you a guarantee of settlement even before you start your specialization training, because actually you are doing a job. Sometimes I wonder when I say that I am guiding doctors and dentists for their medical dental licensing in Germany followed by their specialization training. I should say that I am guiding doctors for their employment in Germany, and their specialization training is nothing but a byproduct of their employment. Fine, doctor. Now just to take it further from here, doctor, I just want to make you understand that as a doctor, as a dentist, whatever challenges, whatever limitation, whatever hardship or handicap you are finding as a part of the Indian system to be a specialist in medicine or in dentistry, all these are nothing but guarantees, solutions or remedies for you in Germany. To name some of them, in India, once you are getting a license to practice medicine or dentistry, the license is making you eligible to work as a doctor or a dentist. But that is not giving you an assurance to start your specialization, because for that you need to go through a very competitive exam of NEET PG, NEET MBBS, and to be a super specialist you have to go for NEET SS. So it means just having a license is not a gateway to start your specialization training. You have to come in merit through a very competitive exam, compete with your fellow doctors and dentists, prove to them that you are a better doctor or a dentist with them, and that will make you eligible to go for a government seat or a paid seat or what it may be. Fine. Unlike the Indian system where we need to go through a competitive exam, in German system we need not have to go through any competitive exam. Once you get a license to practice medicine in Germany or dentistry in Germany, you can start your job, and while doing a job you can be trained as a specialist. The second point which I think is a point of concern for all doctors and dentists is that most of the time the doctors and the dentists have to compromise on the choice of specialization, because the choice of specialization depends upon the merit that you get through this competitive MCQ-based exam or your financial pocket or the financial bandwidth, so as to say. But in the German system, you are eligible to pick your choice of specialization, because when there is no competitive exam in Germany, you don't get marks, you don't get a ranking, you are not called for a counseling. It means that once you are getting a license, it is your right to choose what specialization excites you the most. So you will not be sacrificing or diluting on your choice of specialization. Third thing, what I personally feel is, as a doctor, if you are really very motivated and you are very progressive in your thought and you really want to achieve heights and you want to be a super specialist, then again in India you have to go through NEET SS, and you know how the situation is, how competitive it is, and how less the seats are with the reservation to place, how tough it is to get into those things. But in Germany, they give an integrated program where once you start your medical specialization after getting a license, you can come out of a training directly as a super specialist. It is offering an integrated pathway for super specialization. Last but not the least, I have already told you, I personally feel that after you complete your medical education or dental education in India, most of the doctors and the dentists are the opinion that we are looking for an option where we are first settled with a handsome salary, followed by our specialization training, which doesn't happen in India because we are getting it channeled through college and university, as you are aware of. But in Germany, it gives you a settlement option to a doctor or a dentist even before you start your specialization training with the employment. So these are some of the positives which are a part of the German system. There are other positives also I can talk about, because these are the positives which hurts us the most in India. Am I right here? So if you become a part of the German system, doctor, you should be aware that you need not have to go through any competitive exam. You need not have to compromise on the choice of specialization. It is an integrated pathway for super specialty. And last and the most important, it guarantees you a settlement option in Germany even before you start your specialization training. And how it can be all achieved? The next question is that how can it all be done? It looks too realistic to be true. It looks more like a fantasy to you. Am I right here? But trust me, doctor, it is not fantasy. It is real. It can all be done by you in Germany. But before I dig deep into the German system, I was eager to make the things clear to you, and we are all aware of, is that in order to be eligible to work in any country as a doctor or a dentist, and to be allowed to try for your specialization training, you need to have a permanent license or registration of that country. As a doctor from India or from any other part of the world, when you have done your education in your country, you completed your education, you went to your internship, you've been granted a license or a registration that allows you to work in your country as a doctor or a dentist, and it gives you the access to the system so that you can become a specialist. Likewise, in Germany, if you want to work as a doctor in Germany or you want to work as a dentist in Germany, that time you should have a medical or a dental license or registration of Germany. And the medical license or the dental license in Germany is called Approbation. So once you are able to get Approbation in Germany, you can work as a doctor or a dentist in Germany, and you can start your specialization training. So doctors, whatever efforts, whatever time, whatever money you are investing will all be converging to a single point of interest of you getting a permanent medical license called Approbation, making you all the dreams that you have always dreamt about. And we for Mission Germany, the entire team of Mission Germany, are guiding doctors and dentists for their medical and dental license in Germany, followed by employment, and then followed by a specialization training. Now let us dig deep and see how can we get this license to practice medicine in Germany or dentist in Germany called Approbation. And to your knowledge, doctor, and to your surprise, I may say that as a doctor, as a dentist, you have to just fulfill one requirement to be a part of the system. And what is the requirement all about? To your surprise, frankly telling you, to your surprise, I think, and to your knowledge, whatever qualification, whatever academic credentials, whatever clinical experience, internship you have gained and acquired in your home country or in India are all accepted, recognized and acknowledged by the German Medical Dental Council. When the German Medical Dental Council are acknowledging your qualification as a doctor, fine, they recognize your internship, they recognize your license. In order to be eligible to get a license or a permission to practice a doctor or a dentist in Germany, you need not have to go through any clinical exam. I repeat my statement here. In order to go and work in Germany as a doctor or a dentist preceded by a license, you need not have to go through any clinical assessment exam. But for getting a license, you have to fulfill one requirement. And what is the requirement? That you should be rocking in German language. Because German says that we are accepting everything what you are doing in your home country. Everything. But when you want you to be part of our system, we expect you to be good in German language so they can connect to our people, you can understand the system, you can understand the documentation and become a part of the entire system. For learning the language, the only requirement, if you can learn a new language which is German, then you are part of the process. And to assess your performance as a doctor in German language, to assess your performance as a doctor in German language, you have to go for 2 qualifying verbal viva exams in Germany. I repeat my statement again. In order to be eligible to get a license and to assess your performance in German language, you as a doctor, as a dentist, have to go for 2 verbal qualifying exams in Germany. Both these exams are executed in Germany. The name of the first exam is called FSV or called a Fachspracheprüfung. With the help of which you get temporary license, and with the help of the second exam called KP or the knowledge test, you will get a permanent license. Both these exams are actually oriented to assess your performance as a doctor, as a dentist in German language. As the medium of these exams are in German, and the objective of this exam is to assess your performance as a doctor, as a dentist in German language. Efficiency and proficiency in German language is a must. Both the colloquial part of German language, starting from A1 to C1. Now, how much has to be learned in India? How much has to be learned in Germany? That I'll anyway be telling you the course of time. But you having a firm knowledge of German language to the level of C1 is compulsory, followed by the technical and the medical German. So, doctor, the only requirement you have to fulfill to be a part of the system is that you should be ready to learn a new language, which is German. Once you approve the first requirement, then you should be ready to fulfill 2 conditions. Or I can say you should be ready to approve 2 conditions. And what are the 2 conditions and situation? The first condition or situation which I want to highlight is that you should be made very aware of the timeline. How much of time it will be required by you to execute the entire process so they can start working and earning in Germany. Because time is important for all of us. Time is money. We have invested so much of time for your medical, dental studies. We aren't looking for anything which has got ambiguities and we aren't sure how much of time it will take. You should have a very defined timeline. And unlike any other system like USMD, PLAB and all, where the things are so ambiguous that you cannot define the timeline, in German system, if you really play it good, we can define the timelines. And for your knowledge, doctor, the day you take a call to go to Germany and start learning the German language, fine, and we start doing the documentation for you, it will take around 8 to 10 months of time in India. You will take around 8 to 10 months of time before you go to Germany. And why we need the 8 to 10 months of time? This 8 to 10 months of time is required by you to learn the basic German language, which will be anyhow provided by us to all our doctors and dentists online at their convenient time. While you are learning the language, doctor, we will be representing you in Germany, and my team of doctors and dentists will be representing you in Germany and doing the application on your behalf with the German Medical Dental Council with all your academic records and credentials, so that we are able to arrange the necessary recognitions and approvals from there, so that you can enter Germany with the right visa category at the right time at the right location. So trust me, doctor, the day you take a call to go to Germany to the time you land in Germany, you take around 8 to 10 months of time. And this 8 to 10 months of time, doctor, is not a waste of time, but a productive utilization of your time in concurrence with what you are doing. In the meanwhile, what I mean to say, this 8 to 10 months of time, doctor, you are anyhow eligible to do what you are doing. If you are clinically connected in any clinic, you can keep doing your job. If you are doing your internship, you can keep doing your internship. Or any other trade which is keeping you busy, you can keep doing it without getting it affected, because we just need 1 hour of time every day from you. So this 8 to 10 months of time is a productive investment of your time in concurrence with what you are doing. So once we cover this 8 to 10 months of time in India, our work is only half done. For the other half, we have to go to Germany. And once we are in Germany, doctor, we invest around 7 to 8 months of time in Germany, learning the advanced level of German language. Right? Because the basic level of German language, the level of A1, A2 and B1 is anyhow done by you in India. And why you have done that A1, A2, B1 in India? Because you want to convince to the German authorities that you are a motivated doctor or a dentist who is eager to be part of the German system. That is the reason you are taking the pain of learning the language at the level of B1 in India. But B1 is not enough. We need to learn the advanced part of German language. For that, in the right environment in Germany, with the right setup in Germany, you will be learning the advanced level of German language, so that you can hone your skills in the language and come at par with the German, or come at par to as closer to a German. Because I personally feel learning a foreign language in a foreign land will not make you as good to compete with a native in German. So you have to be in that setup. So in that 7 to 8 months of time, doctors, you will be taught the advanced part of German language. Once you cover the linguistic part of German to the level of C1, we will start training you for the technical or the medical German, so that you are able to understand the system which is followed in Germany, the protocol which are followed in the German medical system, the documentation pattern, the rules regulations set by them, as well as learn the technique of the medical German so that you are ready for these qualifying verbal exams of FSP and KP. And during the same time, doctor will be even looking for a job offer letter for you so that you are eligible to apply for these exams. So in a nutshell, doctor, I can say the day you take a call to go to Germany, to the time you start earning and working in Germany, you should have a total time of around 15 to 18 months. Out of this 15 to 18 months, doctor, around 7 to 8 or 9 months of time is invested in India productively, as I told you in the past, concurrently with everything what you are doing, and other half in Germany dedicatedly invested to learn the next level of German language, to understand the environment, the system in Germany, getting yourself trained with the technical German, arranging a job offer letter, getting an appointment date for the exam before you attempt the exam, qualify and get a license. So you should have a timeline of around 18 months in hand. This is the first condition or the situation you should be ready to accept and acknowledge. And the second thing which will be always very important for you is the finance. If not for you, at least for your parents. So as a parent especially, for the parents especially, I want to just let you know the total cost of the process. From the first step of you learning the basic German language in India, to the advanced German language learning in Germany, to the cost for the preparatory program for the qualifying verbal viva licensure exam, to the cost incurred for your visa application and the visa approval in India, and last but not the least and the most important, the most costly, the application with the German Medical Council, the translation of all our academy records and credentials, the legalization fee, the verification fees, the authentication fees, and sort of lot of other fees which have to be paid by you for the services rendered by the German Medical Council cumulatively will come to around 14 to 15 lakhs. So in a nutshell, doctor, to execute the entire process from A to Z, you should have a berth for around 14 to 15 lakhs. You can always have a small variation depending upon the euro rate and in which state we are doing an application, because every state has got their own norms, own payment structures and their own fees and all. And euro rate is always fluctuating. So depending upon all these external variables and factors which are not in our control, you should have a financial bandwidth around 14 to 15 lakh, up and down 4-5%. But 14 to 15 lakh, doctor, is not the only cost. When you go to Germany for the first 8-10 months of time, you aren't working there. When you aren't working there, you aren't earning anything. So you should have money for your survival and subsistence in Germany. So before your visa is approved from India, it is a prerequisite that you should have a blocked account of nearly 10 lakh rupees in your blocked account in a German bank on your name, which acts as a security for you for your survival in Germany for the first 8-10 months of time. And it is a compulsory requirement set by the German authorities. So if you are trying to understand the entirety of things and want to understand the entire financials to be involved for this process, you should have a purse of around 24 to 25 lakhs, where around 14 to 15 lakhs is tentatively the cost of the process, which had to be invested by you in 5 to 8 small installment, depending upon the phasing and the progress of your process in around 8 to 9 months of time. And you should have a total financial purse of 25 lakh, including the living cost. So in a nutshell, doctor, if you are really progressive and you are an uncompromising and a very motivated doctor or a dentist, and you want to achieve heights in the professional level in the clinical part of dentistry and medicine, where you don't want to compromise anything, you want to be part of the best system possible technologically and all, and you got a vision and a mission to be really a fantastic specialist, and you want to really celebrate your life and a career, then you should be ready for 3 things. Learning a new language which is German, have a timeline of 18 months in hand, and a total cost of 24 to 25 lakh. If you are ready to approve the 3 things set by me, then whatever I said is my guarantee. You put efforts in learning the language, getting you a license to practice medicine or dentistry in Germany is my guarantee. So I hope, doctor, with this small discussion what we had today or whatever you have heard me out, it must have given you a basic understanding how the entire German system works. What are the positive, what are the negative, and what are the challenges. And if you feel to know more about it, you can always come back to us. You can always visit our website www.missiongermany.in. You can even connect to my team so that I can talk to you one-to-one, so that I can give you a better clarity of things, so that proper knowledge transfer is given to you. And if you feel that this is an option which you can achieve and you can learn the language, you can give time and you have the financial bandwidth for the same, then we can always collect it and we can surely help you out in visualizing your dreams. I can always say one thing, doctor. Whatever I just said must be said by multiple people in different platforms. Having an idea about, having a knowledge about all the things is one part. Having the credibility and the confidence of executing is the other part. I belong to the second part where I am confident about my capabilities. I have been doing the thing for such a long time, and I am sure that I can do the same thing for you. So if you trust me and if you really want to build your career, come to me. I surely will be there to help you all the way. I want to contribute positively to your cause and add value to your life and a career. So it was lovely connecting with you, doctors and dentists, and it was so fine that you heard me out fully, and hope to connect back again. I wish you all the best, and before I sign off, I can always say one thing, doctors. If you change nothing, nothing will change. Let's try to change ourselves. Things around with us will always change. So let's change ourselves first. Let's not creep on the point that nothing is changing around me. Things are so vulnerable. The things is so lousy. The things are not happening here. All certain and fine. We are all part of the same system. It's same for everyone. It's up to you how to change yourself. If you change yourself, your situation will change. I guarantee you. Fine. It was lovely connecting with you. Again, wish you all the best. Keep doing the good work. Keep pushing hard. Trust God. Trust yourself. You are good people, and good things will happen to good people. Right? Thanks a lot. Bye bye.